Now, COVID-19, 1 year later, heartache, heroes, and hope. All this week, 12 News is taking a look back at this challenging year and recognizing our frontline heroes.
The pandemic overwhelmed hospitals around the world. Doctors and nurses began running out of places to put patients.
As you're aware, to handle that surge, Rhode Island set up 2 field hospitals back in April, and nearly a year later, both of those are set to close in the coming weeks. Joining us now live via Zoom is Dr. Selim Suner, the medical director of Lifespan's Field Hospital at the Convention Center in Providence. Doctor, thanks for joining us.
Thank you for having me.
You joined us right here at 4 live back in early December, and at that time you said the situation felt like a nightmare. What is your assessment today?
Well, today things look much better. The numbers of patients with COVID-19 have decreased significantly. Hospitalizations have decreased. The positivity rate has decreased. And with that, we are making the decision to close the field hospital at the Convention Center.
Yeah, Dr. Suner, you mentioned the fact that hospitalizations are dropping. We've been reporting on that precipitous drop. Are things starting to look and feel a little bit more, dare I say, normal in the emergency room these days?
Well, things are not normal. You know, we're still very vigilant about personal protective equipment, wearing a mask, keeping our distance. The emergency department volumes are picking up as the COVID-19 cases are decreasing.
And with the closure of those field hospitals, obviously it's very much data-driven, as you were mentioning. Do you feel it's ambitious at all? Do you think we will need to reopen them?
I wish I could predict the future. Who knows? With the new variants that are popping up here and there and their higher infectivity rate, there is a chance that we may see another surge. But at the same time, the vaccination rates are increasing rapidly. And if we can stay vigilant with masking and social distancing, I think our chances are good at not having another surge.
That is good news indeed. With visitation starting to reopen at our hospitals here in Rhode Island, I wanted to talk to you about something that you might have seen on the front lines, the isolation of patients. And your son, Kaya, started this terrific program called COVID Connectors to get iPads to people who were isolated in the hospital so that they could talk to their loved ones. How critical was that program for the people who were in the hospital?
I think it was very critical. In fact, in the field hospital, we've used some of the devices from the COVID Connectors program, and people are isolated. It's a strange environment, and them having a device to connect with their family and loved ones was crucial.
And I'm sure that you are certainly proud of Kaya. Dr. Suner, you're also a professor of emergency medicine at Brown. When you get back into the classroom, how will this experience dealing with coronavirus change the way that you teach that class?
Well, in some of my classes, I always refer to the 1918 influenza pandemic. But now I have my own experiences to expand on that lesson.
And doctor, at the beginning of our hour, we saw a very emotional woman who was receiving her vaccine. Are you getting to see much of that side of this story playing out? You're so in the middle of the COVID kind of saving people's lives on that side. Are you seeing the other part of what's unfolding right now?
Yes. As you know, Lifespan was in the forefront of vaccination when the vaccines first came out. And it was a team effort. Everybody was involved, and I saw the development of that system and the patients getting vaccinated, as well as the healthcare providers.
Better days are ahead. Yeah. Dr. Selim Suner, thank you so much for taking the time today, and thank you for all of your work on the front lines.
Thank you for having me.